And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about a bunch of different topics. Right now, we are going to talk about tummy tucks. Very popular.
Very popular.
Tummy tucks. Who's a good candidate for a tummy tuck?
So tummy tucks are good if you've got loose skin on the belly, especially if the muscle's been stretched out with either weight gain and loss or pregnancy, and if you're done having kids.
Okay.
Yeah, if you're planning on having more kids, probably worth delaying.
Okay, good. Big tummy tuck, mini tummy tuck. Is there a difference?
Yeah, the big tummy tuck, it takes care of the whole abdomen. So from the ribs down to the pubic area, everything gets tightened, extra skin's removed. There is a scar around the belly button because we leave the belly button in place and kind of pull the skin over it, and then there's a scar down below. With a mini, there's just the scar down below. In order to be a good candidate for a mini tummy tuck, if you cover up your belly button and everything below, and you like the way the upper part of the abdomen looks, then a mini tummy tuck may be the right answer.
Good to know.
But when the skin's folding over the belly button, that doesn't really get help with a mini.
We got to go to pics, but how about scarring? Let's go to pictures while we talk about scarring.
The length of the scar is determined by how much skin there is. So you can see her scar, well, you can kind of see her scar down below there.
Not bad, though.
She had some laxity, tightened up the muscle, got rid of the extra skin that's there, and kind of gave her a much flatter belly.
Looks fantastic.
And the scar is just the length of where the skin is redundant.
And it's covered by underwear, bathing suits.
Yes, we try and keep it low, very low.
Next picture. Can you do a scar if somebody has had a C-section also?
A C-section, yeah.
Just combine the scars?
Oh, thanks for moving the fork. The extra skin is sort of folded right over the waistline there.
That looks good.
So, you know, she's obviously in good shape, not overweight, but that little bump there doesn't look great being
always
closed.
A pain. Okay.
So even at a close. So really what I've done is take off that extra skin, tighten up the muscle too. You can see there's kind of that center part of the muscle pushing out.
Yeah.
That's all brought back in. It's like putting a corset on inside.
Okay. So you sewed up the muscle while you were doing the skin.
Yes.
Downtime on this, next picture?
So downtime, about a week, a couple weeks, something like that. Here we've got a little extra skin going a little farther around, so the incision's going to be a little bit longer in this case.
That looks fantastic, though, the after picture.
Yeah, and again, she's in great shape.
Yeah.
And she works
so it just gets that little that you just can't get rid of, right?
Exactly.
After you've had a baby, or you just can't get rid of that loose skin.
Can't get rid of loose skin, and then the muscles kind of lets the guts push forward. So tightening the muscle helps too.
Got another picture? And so
and here we've got a little more muscle laxity. So in this case, a lot of tightening of the muscle. The scar, again, a little bit longer because the skin's coming around. But it just gives her back her shape.
That looks really good. And I mentioned C-section scar. Do you combine that, or? Actually,
I'm normally going below a C-section scar, so that scar is removed.
Oh, okay.
And that's a really common complaint, because the C-section scars tend to stick down, and then skin folds over it.
Okay.
And even in any sort of tight dress or something, you can kind of see that irregularity. So when we're tightening it, we're putting it together in layers so that it'll be flat when we're done.
All right, so women, when they have C-sections, they can, you know, after those are done, it's very, very painful, right? So when you are suturing up the muscles after a tummy tuck, is that the same pain
it's similar.
after?
I've had patients tell me it's the same, a little bit less, but similar.
Okay.
It's the same muscle layer, though I'm not cutting the muscles. I'm not having to
go
go through it
like
a C-section.
That's good.
I'm just tightening that outer layer. But that layer has its own nerve supply, and it notices that it's tight. And usually the complaints of tightness will last sometimes several months, but not where it's limiting activity.
Okay, good.
Just
So
when
you
you're
can
reaching
stand
overhead,
up.
it's like, oh, it still feels a little tight.
Okay.
But I find the folks who complain the most are also the ones who complain the most when the tightness goes away.
Oh.
Because they're worried now it's
now it's going to expand again. Can you combine tummy tuck with other procedures? I know we've heard about the mommy makeover.
Mommy makeover is usually doing something with the breasts, and the reason it's a mommy makeover is because that's with pregnancy, the breast and the belly both take a hit. Very common to combine liposuction, especially to the flanks around the back, just so everything matches.
Do men ever get tummy tucks?
Yeah.
Yeah?
Not as often, though, because men, we tend to put fat inside.
Oh,
so if you feel a guy's belly, a lot of times when they're overweight, it's tight, the skin's very thin, there's no fat to remove there.
Right.
And if it's overstuffed, it's hard to tighten up. It's hard to put a corset on and make it flat. They have to lose the weight.
And then what about anesthesia for a procedure like this?
General anesthesia is recommended.
Okay.
Don't want to try this one under local.
Don't try that at home?
No.
Okay.
Usually general anesthesia. The advantages are, you know, you go to the surgery center, we put the medicine in, and then you're done.
All right.
So you don't have to worry about the middle. And I do keep people overnight for this.
Speaking of overnight for that?
Yeah.
Speaking of done, we're done.
Yay.
I am so sorry we're out of time. Thank you so much, Dr. Mele. All right, for more information about Dr. Mele, you can call 925-943-6353 or check him out on the web, drmele.com or sanfranciscobreast.com. It is always so great having you in the studio with us.
Being
you
here.
give out such great
fast.
information. Everybody learns a lot. Thank you so much. Happy holidays, everybody. We'll see you later on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.